Hello, we're back. Hey, Maria. Okay, back to the study. Healthcare policy and delivery. A skilled nursing facility can provide all of the following except physical therapy and other types of rehabilitation, skilled nursing care and medical care. C, reimbursement by Medicare. D, provision of custodial care. Remember, if it's admitted, it's in. If it's outpatient, remember that prompt. So the answer is D. Provision of custodial care. And here's a rationale for it. Custodial care is provided by nursing homes, SNFs, are reimbursed by Medicare and can provide skilled nursing and medical care. The patient is discharged, which is B, out, from the hospital, but needs therapy and skilled care. He or she is usually transferred to a SNF. SNFs have transfer agreements with local hospitals for extended care. These patients are unable to perform from 2 to 6 activities of daily living. Patients with Alzheimer's and other types of dementia are usually cared for in nursing homes. So A is admitted to the hospital. B is anything beyond in Medicare coverage. Next question. We're going to do this. So do this. Okay. So a nurse practitioner is writing a referral for a middle-aged diabetic who has an A1C of 8.5% despite being on 3 anti-diabetic medications. She was referring the patient to an endocrinologist. What type of relationship exists between the nurse practitioner and the endocrinologist? A, consultative relationship. B, a collaborative relationship. C, a referral relationship. Or D, a formal relationship. Okay, let's see. They're writing a referral for a middle-aged diabetic whose A1C is 8.5%. And they're being referred to an endocrinologist. I'm going to get a consultation, but they're working together, so it's collaborative, higher level of care. A collaborative relationship is a formal relationship process sharing responsibility for treating a patient together. Sharing progress reports, notes, for example, referring a patient to a specialist or to rehabilitation. Because you're the primary provider. You got this. You're just going to kick Fanny as a nurse practitioner. I'm just claiming this. I already know it. You got this. You got this. Okay, next question. Medicare Part D reimburses for which of the following services? D. A, preventative health care such as routine pap smears and physical exams. B, prescription drugs. C, alcohol, misuse, abuse, and counseling. D, over-the-counter drugs and vitamins. So it's B for prescription drugs. And that's a supplement. Medicare Part D is a voluntary program that charges a premium. Like all Medicare services, patients need to enroll during the open enrollment periods during the year. There's a penalty for late enrollment. There's a drug formulary, and not all drugs are available or reimbursed. Use of generics is preferred, and there's a spending limit. Medicare Part B will reimburse for alcohol misuse abuse treatment. B is beyond the hospital. A is admitted. So I guess we're talking Humana and AARP and stuff like that, a supplement for D. So D would be doggone premiums. Okay, here we go. Obamacare. The Patient Protection and Affordability Care Act, enacted into law under President Obama, sought to expand health insurance coverage for Americans. All the following are true statements about this law, except A, pre-existing health conditions cannot be used to exclude individuals from obtaining coverage. B, the health plan ensures that all Americans have health insurance coverage. C, young adults up to the age of 26 years who live with their parents are covered under their parents' health insurance. D, employers who choose not to participate in the National Health Insurance Plan are fined. I always found that one interesting. If they can't afford to buy it, they're fined. Well, Obama plan, or PPCA, ensures that all Americans have health insurance coverage. And here's the rationale for it. The National Health Insurance Plan, officially known as the Patient Protection and Affordability Care Act, and unofficially nicknamed Obamacare, was enacted in March 2010 with the goal of expanding health insurance for the millions of Americans who are uninsured. It prohibits an insurance company from rejecting people with pre-existing health conditions, which is awesome. There's also a penalty for employers and individuals who choose not to participate in the National Health Plan. Although increased numbers of Americans gained insurance as a result of the law's passage, many millions more still lack coverage, which I've seen here in Southern Texas. I've met so many people who have cancer and other morbidities that have no health insurance to help them, or they can't afford the care, and that's a travesty. On to the next. According to the U.S. Preventative Services Task Force, which of the following tests should be used to screen for lung cancer? A chest radiograph. B, a bronchoscopy with biopsy. C, low-dose computerized tomography, LDCT. Or D, a sputum for cytology. And it's for lung cancer, not TB. So it'd be the low-dose computerized tomography. They're looking for the smoothness of the lungs, any lumps, any abnormalities in that. A sputum test would be for TB and other things. So, then you don't need a bronchoscopy with a biopsy to originally test for lung cancer. So, low-dose computerized tomography, here's the rationale. The U.S. Preventative Services Task Force recommends annual screening for lung cancer with low-dose computed tomography in adults aged 55 to 80 years who have 30-pack-a-year smoking history and currently smoke or quit within the past 15 years. Discontinue screening once a person has not smoked for 15 years or develops a health problem that substantially limits life expectancy or willingness to have curative lung surgery. I have a friend going through that now. Keep them in your prayers. Which is the truest statement regarding claims-based malpractice insurance policies? This goes down to the C, cover yourself and have your own insurance all the time, regardless if your employer gives it to you, which is a nice gesture. A, If the insurance company's lawyer finds the nurse practitioner negligent, it is the nurse's responsibility to pay for the claim. C, claims against the nurse practitioner are covered as long as the nurse had an active malpractice policy at the time of the incident. C, claims against the nurse practitioner are usually paid if the nurse is found not to be negligent. D, claims against the nurse practitioner are covered if both the incident and the claim happen when the policy still is active. It's a little bit like car insurance. Get your car insurance when you drive your car. Well, as long as it's full coverage, then. Okay, so it's claims against the nurse practitioner are covered if both the incident and the claim happen when the policy is still active. I knew you got that right. The rationale is, therefore, both the incident and the claim have to be filed when the policy is active during the coverage time. When the nurse practitioner stops paying the premiums for this type of policy, it's no longer active. Just like car insurance. Okay, here's the last one, a healthcare policy and delivery. All of the following are considered overarching goals in Health People 2020, except A, achieve health equity, eliminate health disparities, and improve health of all groups. B, create social and physical environments that promote good health for all. C, promote quality of life, healthy development, and healthy behaviors across all life stages. D, encourage sexual abstinence and condom use. All of them sound really good, but they didn't talk about the sexual issues on the goals. At least from what let's see. The answer is D, encourage sexual abstinence and condom use. Healthy People 2020 has 4 overarching goals. 1, attain high quality, longer lives free of preventable diseases, disability, injury, and premature death. 2, achieve health equity and eliminate disparities and improve health for all groups. 3, create social and physical environments that promote good health for all. 4, promote quality of life, healthy development, and healthy behaviors across life stages. Sexual abstinence is only one specific area of sexual health promotion. And that does it for that. Next, we'll be doing assessment.